welcome our next presenter for today, Rhonda Lee Grantham, on her presentation on midwifery work in Indian country. And Rhonda is an Indigenous midwife and herbalist and is the founder of the Center for Indigenous Midwifery and the Canoe Journey Herbalist Project. She is guided by her lens as a cultural anthropologist and Native woman, along with her passions for global health, family wellness, and culturally centered care. So thanks for being here today, Rhonda. I'll hand it over to you.
Okay, unmute is always a good place to begin. And can people see my slideshow okay?
Yes.
Okay, beautiful. So yes, it's always hard to go after Nicole. She's such an amazing speaker. But I do think that the threads, you know, in whatever corners we're coming from, in whatever ways that we're trying, you know, to both serve our communities and restore our traditions and, you know, just support families that, you know, we have a lot of different ways and that we're all working for the same thing. So I want to just, you know, thank you all for being here, for hearing a little bit of the ways that I dedicate my hours and am, you know, working to support this work. And this image, I'm just going to begin with this painting, which hangs in Changing Woman Initiative, actually. Nicole had commissioned this painting for an Indigenous Birthkeeper gathering in Albuquerque. And I fell so deeply in love with it, I asked if I could, you know, adopt the image and have it just move forward with the Center for Indigenous Midwifery. And the reason I love this image is because, you know, I do see people that are coming together. You know, I picture that, you know, these are, you know, that someone in this circle here, you know, has a round belly. You know, there's probably people who are, you know, tending their elders at home. There's probably elders in this circle. There's probably a little one on someone's lap. Maybe they are, you know, preparing a meal. Maybe they're sharing stories. You know, maybe they are having a council of wise women to help guide their community. Maybe they're just preparing and thinking and dreaming on how best to support and, you know, to guide and direct, you know, the vision for family wellness and community wellness. So I want to just begin with this picture and have you just walk with me. I didn't really choose the title for this presentation, and I didn't respond to the email on how about this title. But as I was preparing my slides, I just started thinking of what is it that I want to share. And, you know, what I want to do is I want to acknowledge, you know, the legacy of midwifery, the current reality of what our people are struggling through, and then, you know, hopefully plant some seeds for how I feel like we can all be working together to help grow and shift and change the aspects of trajectory that are not serving us. And I want to just begin with these two photos. I want to begin with these two photos because it feels important to ground in where I'm coming from and the stories that brought me here. You know, way before we talk about the work and the how and the programs we choose and the ways that, you know, we choose to dedicate our energy, I want to just ground in that. I feel as if these two photos explain so clearly exactly who I am and, you know, what I want, you know, to dedicate my life to. So on the left is a photo of my grandmother. My grandmother was matriarch of my Cowlitz family line. I'm a member of the the Cowlitz Indian tribe, a Salish Sahaptin tribe in Southwest Washington. We were a tribe that we refused to sign a treaty. We were a very large and powerful tribe that were river people and horse people. And, we were this bridge between the people of the river and the oceans, as well as all the way up to the mountains over to our Tidnapum people. Our Tidnapum Cowlitz were this bridge between coastal Salish and Sahaptin people, like Yakima and those tribes. And so we had a very large land base. And when it came time to sit with treaty with the Chinook, with Chehalis, with other nations, our people were being offered to relocate to tiny reservations on the coast, away from our, like many of you in your tribal stories, away from our sacred sites, away from our ability to provide for ourselves, and a very tiny space in contrast to the very vast area that was our usual and unaccustomed territory. And with that, refusal to sign that treaty came, several decades of displacement, a fierce fight to the government for recognition. And our people were scattered to the winds for a little while, and many went to other reservations. My family, went to Nisqually territory, and so my family is both Nisqually and Cowlitz, enrolled Cowlitz for the most part. And when I would sit with my grandmother and hear her birthing stories, I heard, stories of, being a very, very, very young mother in horrible circumstances. I heard stories of abuse and trauma and addiction and a displacement and literally having to flee to survive. But I also saw a woman who did exactly that, and who told stories of how she needed, to hide and to, not to try and blend in, to try and not look, let alone speak or be the Indigenous woman that she was. And these are the stories that many of us, right? That many of our family members who were subject to boarding schools, who were taken away from their healers, their communities, their foods, their midwives, and what they survived through. And when it was time for me to give birth, I spent a lot of time with my grandmother, nearly all day, every day when I could. And she would just, talk with me and share with me. And I so treasured that time. And I also, crafted like what the stories were that I didn't want to be my legacy, that I didn't want, that I wanted to change. And I knew that I wanted to birth in ceremony. That was always very clear. My mother taught me birth. And, I'm the second of 15 children. She loved, still loves just, talking everything about birth. But in terms of someone to attend me with, my medical needs, if we'll look at it that way, I just, I ached and was sad that there were no midwives in my nation. I'm a mixed person, and my mother taught me birth, but my father's side is my native side, and the family that I, my grandmother that I connected to with Indigenous teachings. And so I was just looked around like, how did this happen? How did this come to be? How is it that there are no, Native American midwives in an area that is so rich in so many ways? We have, so much cultural resurgence and so much cultural pride. How is it that so many of my relatives and tribal members are, moving try, fiercely fighting to restore our languages and, protect our traditional foods and our lands and our territories. And when it came time for birth, that there was this surrender of power and a complete dissociation. And I knew that I didn't want that. And I fought very hard for that. And I did, have a home water birth attended by other people, very lovely, kind midwives and doulas and lactation consultants and supporters. But I felt like I had a foot in two worlds. I had where, I had to go to my tribal members for a ceremony for, to hold me through, to prepare me, to help heal me after, circumstances with the birth. And then, be tended in other ways by medical people that weren't my community. And I knew and I wanted that to be different for the next generation. I knew that that's, what I fiercely wanted, to have happen. And so this photo on my right is, a photo of my own daughter, Oceana, welcoming her daughter, my first grandchild, Tektikne Aya, which means hummingbird medicine. And she was welcomed as we sang in our language. She was welcomed into her own kaya, her own grandmother's hands. She was welcomed with rose petals in the water that we had harvested in ceremony with our songs, with our connections, with, understanding that this is a plant that guides us through these life transitions. And that the first words that she heard were some of the few words that I know as a person with a language that is endangered. But we could prepare, we could speak from our heart, and we could sing, and we could, prepare our altar space and the people around. And I just want to put this forward that I'm so thankful. And it's not about where or how, but that I saw pride. And when I see the pictures of these two strong women, I see pictures of strength and resiliency. I see pictures of choices to blend in and survive, and choices to stand strong and take up those spaces, to deliberately dream and choose what those first foods will be. I speak often about first breaths to first foods, and how we do have these opportunities to heal the wounds of colonization with these next generations. And so with that work, and in all of the ways, I'll say, people always ask, how long have you been a midwife? And I grew up attending births with my mother, but I chose it as a young woman, as I was 18 in 1995. And I remember just saying, I can resist this, but this is my path. And that midwifery to me looks a lot of different ways. Midwifery to me looks like pieces that do involve my hands. It does look like pieces that involve caring for people, so that they don't have to step into other systems. It does involve ceremony. It does involve, sitting with my, tribal youth and supporting their coming of age. It does mean, saying goodbye, and, doing death midwifery. It is all the same to me. And so my definitions of midwifery and how to become a midwife, often is hard. And I've had to, accept some of the terminology of, a doula does this, a lactation peer counselor is for this scope. And I do think that clarity serves us, so that families can know a bit more of what to expect, because we're not coming into birth with shared expectations of what that even looks like anymore. The there are different pathways of learning, and there are different needs that our bodies may have, that our spirits may have, and we want to be able, to share and stand in our honest truth about, what ceremonies we can offer people and what services we can offer people. And Nicole and I and many, many, many others have, in our several years of holding Indigenous birthkeeper gatherings, have sat in circle and had these conversations of how we do struggle that, will we ever be enough? And part of that is this acceptance that it's because we can't ever be everything, and that we want people to be able to not have gatekeeping around stepping into their medicine, whatever that is, whether it is, I just encourage people to choose pathways that will support them in their goals to being able to do the work that they're called to do. And so, yes, that might be studying for that exam, enrolling in that university, dealing with that state health board, or whatever that looks like. And for others, it's those pieces, academics, for example, came easy to me. But I had to seek out other teachers, and that we're all on that path for the rest of our lives. We are about to begin our initial cohort of our Indigenous midwifery school. And, it is something that we're spending a lot of deep time in, is that, what I am trying to craft and offer is a pathway for you to just, step into your medicine, but that it's a lifelong experience, to be accepting new teachings and seeking out and shining light in places where you need to grow. And so I wanted to just say, I'm going to offer our mission and our vision for this work of the Center for Indigenous Midwifery. And, what I want to just share is that, that when I'm speaking about midwifery, I'm not putting that in as tidy of a box as some people may have. It may be arising in thought. So I want to just acknowledge that when I'm speaking of midwifery, that may be that you're attending a birth, that may be that you are physically caring for someone, it may be, in these different ways. But when I'm talking about the big mission, the big vision, I'm talking about this restoration of having our healers and our midwives be one and the same in the way that they were prior, to this forced removal, this categorization that has happened, where it feels like there's another, that someone's unmuted. Okay, it sounds like it went away. Okay. So anyway, I'm going to get back on track, but what I wanted to just share is that, my hope in this presentation is that I'm going to be able to talk about some of the ways, I call it, we have 3 different pathways that the Center for Indigenous Midwifery is working with, and that there is space and ability to, work through from wherever you are, as a non-Native person serving Indigenous people, as a person who is helping with education, with support, with, helping people connect to their own traditions. Like, for example, I am not, I'm not Maori. I'm a coastal Salish person. And so when I have another Indigenous person in my care, it doesn't mean that I'm, doing all of the same things for her. I want her to be able to connect to her traditions, her foods, her language, her ways, her words, and that's going to be, what I'm going to be dedicated to. And so I'm just going to kind of dive into the rest of my presentation here. and, that have this mission and this vision be kind of the underlying, my guiding light, and that this looks different ways, and it is regardless of where people are birthing or how or who they're birthing with. Okay. I'm going to begin with a quote from my dear friend Autumn. And at an Indigenous birth conference recently, she said this, and I asked if I could quote her. And it was, "Every Indigenous birth, regardless of circumstance, regardless of location, regardless of means, is a holy victory." And I want to just, I want to just bring that back, that I hear every day I'm receiving messages from families who, are trying to just birth differently than the generations before them, who are wanting resources, who are wanting to hear about, how they can reconnect to their traditional ways when they've been displaced, when they've been adopted, when they're living away. And that all of this is, I see as opportunities, and that I want to just say very clearly, I use midwifery, and I talk about my organization as Center for Indigenous Midwifery. I do believe that midwifery is one of the key ways, but it is not the only. Our families need support in all of the ways, and simply surviving is a holy victory. Our disparities are real. The burdens on our bodies are real, and we have to acknowledge that first. Every lost family, every person who, it impacts their parenting because of a traumatic birth, every drop of milk that isn't able to flow because of lack of support. That's what I'm working on fighting against, is to help arm people with resources and support from wherever they come from and from whatever they can hold, and so that they can just move forward in that. And so a lot of this work comes back to, this was a gift that was given to all of us at an Alaska Indigenous Birthkeeper gathering. And this painting was given to me, and I loved it immediately. I'm also a salmon people, but also just, reading this, and I was like, yes, this is the guiding light. And that is, this painting is called Our Agreement. And it says, "I will nourish your future generations as long as you protect mine." And all of these little white lines, that's what is written again and again and again. And it's this connection to, being land-based, whether you're on your territory or living away from your lands, or have been displaced, that you honor and connect, that you are a person of the land and of the territory. And that we also seek and, are supported to be able to nourish ourselves in ways that are in relationship to the land. And so, with the Canoe Journey Herbalist Project, it's very much an intertribal project where, a lot of the people are away from their healers. A lot of the people are stepping into, their medicine as healers from different nations. And that, it is in relationship where we have to both honor and, very much acknowledge that we may be standing and living on stolen land, and that being in good relationship is a crucial beginning, and that in this work that we are working to restore our agreements with the land, our agreement with our bodies, our agreements with other people in our lives, and that is what will restore wellness to community. Not any one particular idea, but remembering our agreements and honoring them. I feel like when we talk about, for example, with parenting, we can discuss different parenting philosophies and different ways and different tools and different resources. But ultimately it comes down to, are we honoring our agreements? Are we holding, this gift of a sacred child, and, helping to support them and nourish them and grow them? Are we honoring that agreement? And that we can constantly be working, towards doing that work better and better. So some of the ways that we're doing that is, we do need to protect and elevate and share our Indigenous teachings, our Indigenous knowledge, our Indigenous family stories. And this was a project that came, out of COVID, that came out of interviews that started with my own tribal members, to, basically be able to capture the wisdom I was seeing. So many of our language holders, our sacred people being lost to COVID, and that, steps into other ways in our life of not only thinking of what's being lost right now in these hard times, but also what has been lost already. And that some of it can be remembered, some of it can be heard and listened and recaptured, and that we need to hold it close. There are some things that, are, for example, the recordings of my tribal elders that are only for them, only for tribal members, only to be shared, very closely. A lot of our teachings do need to be held very closely in their context, in their tone, in their way, and their responsibility. When I talk often about how there are, I just finished the Intertribal Canoe Journey, and how there are songs that, are gifted to community, and that we all sing together, and we can feel so incredibly powerful as we all join hands in our dancing and singing and drumming, to this same powerful song. And that there are others that are only for specific times in specific ways, and they're my responsibility. And if they've been gifted to me, I'm to honor it as a gift, and treat it that way. And so these particular recordings, I think we've done 52, I think. And they're different episodes that are all available on podcast forums and on our website. And the point of them was that, people were wanting to be able to hear directly. And so, I got an email the other day from someone that was like, can you please just send me back a paragraph on, how Indigenous people give birth? And I'm by questions like that, because one, there is no one way that Indigenous people give birth. We are people. We are dynamically, culturally evolving. We are in touch and in connections with different teachings. We are blends of different houses of people that created us and made us and crafted us. We are, the result of our experiences, our lessons and our teachings. And so, no, I can't answer in a paragraph how Indigenous people birth, or even dream that they would birth. But what I can offer are people who stand strong in certain teachings or want to share their stories. And so there are, like, for example, there is Lakota Scott sharing about, Dene birth traditions. There is a Maori healer who I can just, if I'm working with a family, I can't understand their teachings in the way that directly from someone they can connect with them or a recording. And sometimes this can be that first step. And a lot of home health nurses, a lot of schools, things like that will share these because they're public. The speakers know they're public. They're intended to be public, and they're for everyone. to be able to refer, to share, and people, are doing these recordings while knowing that it is for the public. And so this is just one way of a resource to try and just elevate support. And these are by and for Indigenous families, and they are shared widely. And so if you're working with a family and, like, for example, they want to learn more about a certain teaching or a certain people, or heal from a cesarean, or whatever that looks like, that these are resources available. And the second pathway that we are working on is that families, need and deserve support right now, with whoever it is that it can support them in whatever ways that is. And so, like, for example, these are some programs that are available to families that are pregnant right now, and that we just offer right now. All of our programs are always free of charge. And there's several, like the ones on each side are virtual, and we offer our virtual childbirth preparation workshops every month in English and in Spanish, 2 separate classes. And then we have a weekly drop-in group every single week, just so that people can stop in and, if they are having a lactation problem, or they want a referral to a doula, or they just want to talk about how hard it is to have a teething baby, that's just available for anyone, any Indigenous family anywhere can call in. And then we have a lot of in-person events too. Like, we have our Indigenous Milk Medicine celebration this weekend, and, craft circles and baby massage classes and things like that are directly for families. And we're guiding this under this idea that, I read this, family and community connectedness, spirituality, cultural identity, and our cultural norms have been found to be protective factors and to be as effective as reducing risk factors. And programs that combine risk factor reduction and cultural preservation will make a greater impact at the individual and community level. So, what I want to just speak to is that often programs, and this is partly nonprofit world, partly, healthcare deliverables, when systems are being evaluated, is that, there's such an emphasis on trying to put numbers, like, how much did we reduce preterm labor? How much did we increase, lactation support? Just things like that. And yes, we have to play that game to receive funding and to, be able to bridge access. But what I want to just speak to is that, we are more than our disparities, and that there's often such emphasis on all the things that are burdens on our bodies, how often we're, too fat, too diabetic, too addicted, too homeless, too whatever. And that, we're not, we certainly, need all of those addressed and tended to. But that we will go further if we adapt, that, if we bring in, the cultural pieces. And I don't think that I need to, that I'm preaching to the choir in this particular group, the people that are drawn to serving Native families, and that you're attending a presentation that is focused on culturally centered care. But I just wanted to say that, the people in our childbirth classes aren't going to other classes, and that if we didn't have a specific Indigenous childbirth class, one of our questions that we ask people is if they've attended another childbirth class, and also if they are interested in attending, for example, a hospital-based childbirth class. And we hear again and again that, they wouldn't have attended. They wouldn't have had that health promotional materials if it wasn't a culturally safe space, a culturally centered space. And so I believe really strongly in that, that, that it just needs to be held that way. And then our third pathway, which is honestly the majority of our work, is growing and supporting more Indigenous birth keepers. And that's in all the ways and in all the specialties, okay? And I think that I began speaking about this earlier, of just that, you know, these dividing lines that exist, you know, don't serve us. You know, I'm seeing again and again, you know, for example, a person of the community who has been, you know, offering support within the community can't receive a job if they don't have that RN to be able to provide childbirth education in their community. COVID brought this also very just loud and clear, as in, you know, I was getting phone calls from people who had been supporting as doulas, as we'll even use that word, as doulas. And then because they didn't have a DONA training certificate, they couldn't enter the hospital. But someone who just paid $700 and took a 3-day training from DONA and, you know, did whatever, they could get in. And so we do have this gatekeeping. We do have, you know, these pieces that, you know, are barriers. And so, you know, we do, our majority of our work is in growing and supporting more birth keepers. So that is doula trainings, that is, you know, lactation classes, that is our Indigenous childbirth educator program, which is relaunching in November. It is our first cohort of our Indigenous midwifery training program, where people will be able to become licensed, where they will be able to, you know, fully practice as direct entry midwives. And, you know, this is one pathway to midwifery, but it's one where in my school, we have all BIPOC staff. We have, you know, it's an all BIPOC class. And that there's a lot of supports and mentorship where we recognize that, you know, understanding our histories, understanding that we don't have to separate, you know, food sovereignty from nutrition class, that we don't have to separate, you know, resuscitation from praying in our babies, that we can weave it all together. And so, you know, there's, this is looking like a lot of different ways in these different programs, you know, plant medicine programs, food and, you know, nutrition training programs, doula trainings, birth assistant trainings, and that we've spent the last, you know, 5 years really growing a team. And so now, you know, there are more and more people who are able, you know, to support this work. So, you know, I feel like I want to just share that every community can find their way, and in every community, they know what is needed. They know what the next steps are. They know who can step into that work, and who the community is already going to, and how do we support those people directly? And, you know, that's a part of the goals. And then I want to speak a little bit directly to, you know, about why midwifery, and, you know, why midwifery, and why am I, you know, specifically talking about midwifery. I wanted to just clarify, because I do have a question, that a lot of our, there's only one funder that's specific to King County, and that's our BSK, our Best Starts for Kids King County programming is the one thing that is limited to King County. But most of our programs we're actually Olympia based. so Nisqually territory based, and that a lot of our programs, all of our virtual things are national and global. Our Indigenous Childbirth Ed program was Washington State based, the last cohort. And the next one, the plan is to run a cohort, will be led by Lakota Scott, who's a Navajo a naturopathic midwife and childbirth educator, as well as Marissa Boyanos, who's bilingual and so and a very experienced childbirth educator, as well as many guest speakers and other co-trainers. But that particular program, what we are doing is we are going to do the virtual portion open to anyone in Turtle Island. And then we'll be hosting our intensive Indigenous childbirth educator training, the skills part, in hosted communities. So we know that, there are pockets where there's just a lot of people attending, and in applications prior, those sites, were California, New Mexico, and Minnesota, and Alaska. Which sites that is going to be about collaborations. And so we are willing to enroll people into the virtual portions, and then, but we'll do the on-site portions to communities where the team is invited to attend. So that's just one example. And in the Indigenous Childbirth Educator Training Program, that is, we are talking about nutrition. We are talking about, being able to educate families on health promotion activities, such as birth aid information and safe sleep, and, cultural traditions, and, just supporting health and wellness in all of the different ways, signs of preterm labor, lactation information, all of those pieces are part of the Indigenous Childbirth Educator Training Program, support in postpartum. So I apologize that I feel like I'm bouncing a little bit all over in this presentation, but I wanted to just really quickly honor, why are we needing to focus on this restoration, this reclaiming, these words that just keep being thrown out. And that I wanted to just say that, a lot of what we're subject to and why there are these dividing lines is because we have separated our healers from our midwives. We have separated, we've put midwifery and birth in the category of, innate health services management versus in the care of trained and competent care providers who are grounded in community. And I'm going to just put forward this definition of a midwife that I do not enjoy, but this is the international definition from the International Confederation of Midwives. A midwife is a person who has successfully completed a midwifery education program based on the ICM essential competencies for midwifery practice and the framework of the ICM global standards for midwifery education, recognized in the country where it is located, who has acquired the requisite qualifications to be registered and are legally licensed to practice midwifery, use the title midwifery, and who demonstrates competency in the practice of midwifery. So here we are, on and on and on and on. We have all these terms that are related to systems, to policy, to funding, to legislation. And this is what midwifery is in this country right now. And so many of the people who, would have been, are from generations of midwives, such as the woman in this photo on the left, who supported families for 60 years. But she's never going to be able to satisfy those requirements or enter these spaces that are dominated and have been created to allow in a certain education levels. And there's a reason that there is a tiny handful of Native American midwives in this country, such a tiny handful. And when you look at people who are practicing in the way that they really dream to be, that's even smaller and smaller and smaller. And so I want to just put forward a substitute definition of what I see midwifery truly as. And I'm once again quoting my very, very smart friend, Autumn, who's a Dakota midwife. And her definition is a community-based and community-active presence practiced by an Indigenous person that recognizes a broad, life-encompassing scope of care around and as feminine and family ceremonial rites, specifically safeguarding the passage of new life that maintains access to and the ability to access the knowledge and materials of the times, traditional and contemporary, and seeks the maintenance and restoration of balance in life and community, while serving as an advocate and buffer for those most affected by lives out of balance. Different from a doula or other birth attendant, the Indigenous midwife has specialized practical knowledge regarding the craft, born out of some combination of experience, instruction, spiritual guidance, and land-based ancestral wisdom. So I'm working with this definition to dream into being that families receive support in all of the ways, with their obstetrical needs, with their surgical needs, with their addiction and treatment needs, you know, with their nutrition and welcoming their babies, with the ceremonies for healing, with being nurtured. And that it's not about completing a program. It's about this constant striving to receive the teachings that are supposed to be gifted to us. And I really believe that any of our community members that are suffering is affecting us all. And you know, as a plant medicine person and as an herbalist, you know, I'm always in love and pull quotes from this book on a frequent basis. But I want to just close by saying that the trees act not as individuals, but somehow as a collective. Exactly how they do this, we don't yet know. But what we see is the power of unity. What happens to one happens to us all. We can starve together or feast together. So regardless of the programs you hear about, or ways or opinions on where our families should be birthing, or what credentials the people in these systems should hold or not hold, we all need to share in this vision and this goal of supporting families to be healthy and well, and that there are gifts that we carry and other ways where we need to help bridge people. And, you know, that's my hope. I apologize again for hopping into different spaces in this presentation, but I would happily open to questions if there is time, and I'll visit the chat in the meantime.
Yes, thank you so much, Rhonda, and sharing your beautiful stories, messages, and the photos throughout your presentation were very lovely. And also sharing a beautiful quote from Braiding Sweetgrass, which happens to be one of my favorite books. So that was very nice to hear, and a way to end your presentation. We are heading into our break, but encourage those who need the break to take some time to recharge for our next session starting around 3 p.m. Eastern time. But if anyone has questions for Rhonda, Rhonda, do you have some extra time if folks have questions?
I do.
Awesome. And I'll welcome anyone to go off mute or drop some questions in the chat. I'm sure you're reading the chat, everyone just sharing their love and support for you.
Rhonda, I don't have a question. This is Cindy. It's been such a gift hearing your voice, and you did not jump around at all. This was an incredible story. It was beautiful. It's just so inspiring. I just can't believe, again, I just can't believe that you do everything you do in such an intentional, grounded, and beautiful and culturally inspired way. So thank you so much for everything you're doing. You just gave me so much hope for the future. Buenas noches.
We all squat in the river during the salmon run. Okay, I'm quoting that. Thank you, Cindy. I love you so much, and I appreciate all of your work too. And yeah, there is no one way, there is no right way. We all just deserve to stand in our power.
Well, again, thank you so much for being here, Rhonda. You definitely speak so beautifully and just sharing your stories and getting your messages with us. And I hope you have a great rest of your day. You're welcome to stay throughout the Institute. So I'll leave this time to transition for our next speaker.
Okay, thank you. Yes, and we will have a relaunch of our website, but be sure to sign up for our newsletter. That's the best way to receive information about our upcoming programs.
Thank you so much, Rhonda.